was mentioned, we do want to get to the point where we don't have to acknowledge World AIDS Day, but we're all here to do that together. So as the governor will mention with her leadership, Mayor Elorza and I are here to make a very exciting announcement today. We are not here to announce an achievement or an award, but instead to address a challenge. Along with Governor Raimondo, Mayor Elorza and I will be signing the Paris Declaration for the 90-90 Initiative, which will commit Providence as a city and Rhode Island as a state to achieving rates of 90% by 2020 for the 3 measures in the continuum of care that Dr. Chan just discussed. So thank you for putting this additional board up. We can do this together. I want to walk us through it. First, to acknowledge our team and our staff that worked hard to get our first Rhode Island state continuum of care. So now that we see where our numbers are, we can set the target for where we need to be and where we will be by 2020. So by 2020, we want to have the first 90, which is 90% of all Providence residents and all Rhode Islanders who are HIV positive to actually know they are HIV positive. So we've talked about how we're going to do that, addressing testing and continuing to promote that. We've had success in that. There's a little bit more to go. Our second 90 of the 90-90 initiative is by 2020, we want 90% of all Providence residents and all Rhode Islanders who are HIV positive to be linked to medical care and to be receiving treatment. So that's that second bar. And you see we're at 59.5% and we need to get up to 90%. And that's only going to happen with the effort of the folks within this room. Our third 90 of this crucial initiative is that by 2020, we want 90% of all Providence residents and all Rhode Islanders who are HIV positive to have suppressed viral loads, so that the virus in their blood has been minimized to the lowest level because they are appropriately receiving and taking their treatment sustained in care over time. That is possible to do. Our current number is 55.5%, which is higher than national numbers of 30%, but we have a ways to go to get to that 90% by 2020. So the document that we're going to sign today to really show that we're taking this on together as the first city-state to do it is basically when cities or states join the 90-90 campaign, as we call this document the Paris Declaration. The reason is the initiative started on World AIDS Day in Paris in 2014. Since then, officials in communities where there are true leaders in public health and addressing this, such as Geneva throughout the world, in Buenos Aires, as well as in Atlanta, in San Francisco, all of these communities and cities have come on board. And today, Rhode Island is joining that group. But what makes today so significant, as I mentioned, is that Rhode Island and the Providence partnership that we're doing together represents the first city-state group to join this worldwide 90-90-90 campaign. So we're putting Rhode Island. I'm so proud that together we are innovating in this way. I shared it with my colleagues in the region this morning in our weekly call with the other state health officials to say, look what we're doing, you can follow us as well. By adopting this shared 90-90-90 initiative, this campaign, and this framework, we are going to be tightening and focusing our collaboration, which means that we're going to have a bigger impact in Providence as well as throughout the state. We're also going to be using this 90-90-90 framework when evaluating our existing efforts. So that's the no-cost HIV testing that we need to continue to promote and support. It's also continuing to provide free condoms at targeted venues throughout the city and the state, and to expand resources for adolescents, for communities of color, and for men who have sex with men. This last community is of particular importance to mention. The rates of new HIV diagnoses of men who have sex with men is 90 times higher than the rate for heterosexual men and women. And Rhode Island is not healthy until and unless we see these enormous gaps in health outcomes that exist get closed. That's what our goal is. That's why we're embracing this 90/90 initiative. And it's also why it's a leading priority for the Department of Health to strategically address health disparities whenever they exist in our state. You often hear me say that a person's zip code should not determine how healthy they are, nor should their race, nor should their ethnicity, nor should their gender orientation, or their sexual orientation. So just as addressing health disparities is a huge challenge, meeting these 90/90/90 targets by 2020 is going to take an enormous amount of work. But what we've done here, and following the governor's leadership, always does a great job. We set the targets, and we bring all of these people together who can really make that difference to get us to reach it. So we're currently falling short on a few of them, particularly the last two targets that we need to meet, and we need to address people being engaged in care and people with suppressed viral loads. But the governor, the mayor, and I joined this campaign because with you, we know that as a state and as a city, we can do this. There's so much talent, passion, decades of commitment and perseverance in the HIV/AIDS community in Rhode Island. We need to harness this and work together to get our three main messages out that reflect our 90/90/90 goals. For the first 90, our number one message is everyone should get tested at least once in their life for HIV. If you are sexually active, you should be tested at least once a year or more. That's the first 90 that we're going to get to. For the second one, number two, if you do have HIV, make sure that you're seeing your doctor and you're engaged in care and on treatment. We want to make sure the resources are there to help people do this over time. Our third 90% and our target, our challenging one to meet, but we can do it, is if you have HIV, make sure you're taking your medicine. We need to make sure that it is accessible to people, that taking your medication every day is the most important way to staying healthy and getting an undetectable viral load. And as being a physician who cared for, loves, and has been inspired by my patients, both adults and children with HIV, who I miss, I want to acknowledge and encourage that we can get to where we need to be, particularly for that third 90% target. That means addressing people's housing situation, addressing their employment situation, addressing their education, addressing all of the elements with social and environmental determinants of health that contribute to people staying in care, staying on medications, and staying healthy. And so that's a perfect segue, actually, to pass the microphone to Mayor Elorza, who is a wonderful partner on this cause and many other public health challenges that we face. I want to sincerely thank all of you again here today for the work that you have done and for what we're going to do to prevent and treat HIV and AIDS. Working together, we can help more people who are living with HIV have longer, fuller, and healthier lives.